Gun violence is having devastating impacts in communities of color. Joining me now is Dr. Karen Sheehan. She's a pediatric emergency medicine physician at Lurie's Children's Hospital. Doctor, thank you for joining me.
Thank you for having me.
First of all, were these results in any way surprising?
They were a little surprising in the fact that I would never have thought that we would, in a country, have our youth die from firearms at the rate that we do. I mean, it is the leading cause of death for kids less than 19. I want everyone to think about that. That's just crazy. It surpassed motor vehicle crashes. But within our data, there is some hope. The reason is because we've had the motor vehicle crash deaths have decreased by 50% over the last 20 years. And as you mentioned, firearms have increased. But the reason why motor vehicle crashes have decreased is because we've had a public health approach, and we could use the same approach to prevent firearm injury.
A lot of psychologists say that it is a public health issue. Do you think that legislation would make a difference in this instance?
Absolutely. I think there's two approaches that we need to take to prevent firearm injury to our youth, especially in Chicago. One, and we heard this from the youth today at that conference with Senator Durbin, and that is that youth need long-term relationships, safe, nurturing relationships with caring adults. They need things to do in their communities that support them, that let them express themselves, that give them a safe space to be in. Similarly, we need to have stronger firearm laws in this country, and there's some that are supported by most of the people in this country, like background checks, things like that. Another idea that we can take for motor vehicle crashes prevention is that we raise the driver's license for drinking and driving. You can't drink in any state until you're 21 because we saw so many kids being killed in car crashes. Why don't we consider the same thing, raising the limit for kids to be able to buy a gun up to age 21 instead of 18, where it is in most states?
How is this affecting the psyche overall in the Black community?
Well, I can't imagine it has to be devastating, and that's what we heard from the youth today. I think, race is a social construct, and why we see so much more killings for our Black youth is because they live in disinvested communities. They've experienced trauma for many years. There's the whole issue of redlining. We just haven't invested in these communities. And really, I think the driver of this violence is poverty. And that's why you can see on this graph, the red line is a Black, non-Hispanic youth. And you can see how dramatically more kids die from that category than anyone else. But the blue line below is American Indian and Alaska Native. And similar to the Black youth, they've had long history of trauma in their communities with historical disinvestment.
In reference to the Uvalde massacre this week in Texas, I don't know if you heard it, but Governor Greg Abbott spoke to the NRA through tape that he doesn't feel that legislation would make a difference in mass shootings like this. And he had an AR-15. The shooter had an AR-15. He was 18 years old.
I think there's a lot of evidence that gun laws work. And most people support them. So we have some evidence that child access protection laws are very effective. That holds adults responsible for storing their guns safely. There's some evidence that red flag laws are very effective. Those are ones that police or families can petition the court to take guns away from people temporarily that are having mental health crisis and are a risk to themselves or to other people.
Dr. Karen Sheehan with Lurie's Children's Hospital. Thank you so much. Be safe, be well.
Thank you.
Well, coming